Good evening, everyone. My name is Ashley Nicole, and I'll be your moderator for tonight. Welcome to the Fitness Solutions Cardio Aerobics for Arthritis. We are so excited to have you here today. And so, like I said, my name is Ashley Nicole. I'm the founder and master trainer of RA Warrior Fitness. And so just want to share a little bit about me before I introduce our awesome panel of experts. And so, as I said, I'm the master trainer and founder of RA Warrior Fitness. RA Warrior Fitness is an online-based virtual fitness training business that I launched back in 2020. Last year. So it's fairly new, launched it in the midst of the pandemic. And so I named it RA Warrior Fitness because I'm actually a RA Warrior patient. I'm an RA patient. I have had arthritis for 17 years. I was actually diagnosed. I was late diagnosed. I started getting symptoms when I was in college. I was 21 years old. And so it wasn't until 6 years later that I actually went to a rheumatologist because I was in denial and I got the diagnosis. And so being in denial, I'm not sure why I was, because my mom had it, my grandmother had it. I just didn't realize that, I could be so young and be diagnosed with it. And so with that, I had my own physical fitness transformation. I had my own issues as far as I gained 60 pounds, and then that was really hard on my joints. And so once I formally got diagnosed, I got really serious about my own health, and I lost that 60 pounds. And in the process, as I gained such a passion for health and fitness, I decided that I wanted to be a personal trainer. And so I was feeling frustrated going through to different fitness classes and always having to ask for modifications because my wrist is where I have the most issues. And so, I decided to start RA Warrior Fitness because I knew that there were so many people out there like me who had the same issue and the same frustrations. And so I work with RA patients. I work with anyone who has physical limitations or anyone who just wants to simply get started on their fitness journey. They don't necessarily have to have RA. And so I'm excited to sit on this panel today with these experts who are going to answer some of your questions. We're going to talk about, how to exercise, what's good for you, and the best way for you to keep moving regardless of having arthritis. And so physical activity, we know, is actually one of the best non-drug ways for managing pain and stress. For me, I know it's a huge stress reliever. And so a balanced fitness routine is one that incorporates strength training, balance, flexibility, and cardiovascular activity. So we're going to talk about the cardiovascular activity today. So tonight we'll be focusing on cardio, and our exceptional panel of fitness experts and physical therapy experts will help us understand a little bit more about how to get the most out of our cardio routine while still protecting our joints, because that's the goal, is to protect our joints. Okay. All right. So now let's get into introducing our awesome panelists. So Marty, say hello.
Ashley, hello.
Marty. Hi, Marty. So I'm going to read your bio. Marty Biondi, I'm sorry if I mispronounced that, is a doctor of physical therapy and has been involved in aquatics for over 30 years, using an aquatic interventions for a wide spectrum of conditions, from rehab to sports skill enhancement, as well as functional upgrades. She is part owner of an outpatient physical therapy clinic where she sees a variety of adult orthopedic and neurologic patients. Her research focuses on using aquatic interventions to enhance mobility and functionality. So excited to have you on the panel, Marty. We will talk more with you in just a second. So now I would like to introduce Jackie Crockford. Say hello, Jackie.
Hello. Hi, Ashley. Thanks, everybody, for being here.
Yes, absolutely. So Jackie is a doctor of health science and senior product manager at the American Council on Exercise, as well as the American Council on Exercise certified personal trainer and health coach. She has been in the health and fitness industry for 18 years, working as a personal trainer, a performance coach, a strength and conditioning coach before transitioning to her role at ACE, where she is responsible for the production and continuing education products and study programs. So welcome, Jackie. And last but not least, I'd like to introduce Jessica. Say hello, Jessica Hedler.
Hi, everybody.
Jessica Hedler is a doctor of physical therapy and director at the Hospital for Special Surgery Rehabilitation and Performance Department. She's also a certified athletic trainer, board certified in sports and orthopedics through the American Physical Therapy Association, and McKinsey certified therapist, which focuses on the assessment and management of spinal and other extremity multiskeletal disorders. She completed her clinical competency in aquatic therapy, and her areas of clinical interest are shoulders, hips, knees, ankles, and lumbar spine. Very important parts of the body. So ladies, welcome and thank you for joining us tonight. So let's get started. Our first topic, we're going to talk about just simply getting started, because I know I tell a lot of my clients, the hardest part really is getting started. We just got to get you started, get you into that routine, or if they're trying to take it to the next level, what's the best way to go about that? So when trying to get started with a cardio workout, what are the top issues or questions to consider to help protect your joints? So I'm opening that up to anyone who wants to answer.
I'll start us off here.
Thank you, Jackie.
Thanks, Ashley. So I think, just as you mentioned, we have a stellar group of professionals here that will probably say very similar things, but I think from the aspect of the personal trainer, which is the world that I sit in mostly, and from the fitness professional side, which Ashley, you know all about, I think definitely for those who have received a diagnosis of any type of arthritis, they definitely want to be working with a care team, right? They want to be working with their physician, their specialist, any physical therapy professional that they're working with. They want to make sure that that care team is involved in their desire to continue their movement and to continue their active lifestyle or enhance an activity in their lifestyle. So definitely work with a care team and ask yourself, if that's you, if you are working with your care team, ask yourself, what types of activities do I enjoy most? Because those are the ones that you're going to stick with. Those are the ones that are going to become part of that routine, Ashley, that you mentioned. And then also kind of on a day-to-day, obviously you want to be asking yourself, what is my pain level today? And really allowing yourself to understand what it is and how it might be changing on a day-to-day level. So I'll let our other panelists weigh in on that.
And I think part of it is, like you said, finding what it is that you like to do and doing that, but also kind of having a cross-training program for your cardiovascular fitness, not always doing the same thing. And I think for people who enjoy cycling, it's really important that your seat and the adjustments made to your cycle fit you properly, because sometimes you'll develop joint pain, and it's not because you've done anything wrong, it's just because you didn't fit on the tools that you had to use. And you don't want to become discouraged from something that you really enjoy doing. And I think the last part of your care team, although we're talking about cardiovascular fitness, I think there's always that component of nutrition to making sure that you're fueling for what you're going to be doing for the day, so that you're taking in the right things at the right times to help you be successful in that way.
Absolutely. Thank you so much. And so I kind of want to piggyback off of that, because what about if someone is already a frequent jogger? And what if they start experiencing some knee pain, but they're wanting to step it up to a different level? Maybe they want to, do more than jog. What would you say they could do without stressing out their joints too much? Does anyone want to take that question?
Marty or Jessica, I think from a PT perspective, those physical therapy perspectives, I'll let the two of you kind of hit this one first.
Yeah, so I'll ask the question again. So if, let's say we have a frequent jogger who suffers from knee pain, or someone who is looking to step up their cardio routine without stressing their joints. So they're already in a routine, but, we don't want to create more issues for the joints. So what would you say for them is the best way to step it up to that next level without pounding their joints?
First of all, I think it's, as we spoke before, it's imperative to know what your limitations are as far as the actual tissue. So there are over 200 different kinds of arthritis, and that certainly is a factor. The other piece is actually looking at the routine that you're doing right now and seeing, is it actually safe for what you're doing? Are you, pounding on hard pavement and thinking that's the best way to run, or that's the only place you have to run? Looking also at your shoe choices and saying, is that a possibility? Could we adjust the shoes? I know that's sometimes hard because we all have our favorites, but looking at things, the big picture first, before we really say maybe at some point you do have to limit. And as was mentioned earlier, you have to really understand pain and the levels of pain that you're experiencing.
Absolutely. I agree 100%. Thank you so much, Marty. So now that we've established, just getting started and taking it to that next level. So what about if someone, let's start with walking. Because I know that, the best advice that I can give for someone who has just not exercised for a long period of time and they just want to ease back into things. So I normally encourage, just walking, and then we'll talk about taking it to the next level. So walking is one of the best forms of joint friendly exercise. So we know that. But is there a preferred method? Should it be at home, outdoors, the treadmills, speed walking, stair climbing? What would you all have to say about that? Is there a preferred method? I guess it really would just depend upon the patient, right?
I'll go back to the point I made earlier about finding things that you enjoy. That's definitely important. If walking is not your jam, there are other things to do, but obviously we know it is usually fairly accessible for people, depending on where they are. And there's, different ways that you can go about it. I think, starting slow, as we mentioned, starting with small bouts of walking is a great way to just monitor and see where you're at and see how you're feeling and what, what your body can do at that given moment. But I also would encourage people to think about, as Marty was saying, about, their shoe choice and, different things, factors that might weigh into how their body is impacted while they're walking. So, we're using and seeing a lot of people use different weights or handheld things and things like that. And I would just encourage folks to be thinking about that, again, working with their care team and using things a little bit more if they want to increase cardiovascular effort, using things a little bit more like a weighted vest if they're considering weights while they're walking, rather than on the wrists or on the ankles.
Or on the ankles, yeah, because that was going to be my next question, like ankle weights, like how do we feel about that as far as, it seems to me like that would be a lot of stress, on the joints, especially around the ankles. So I really like that idea about the weighted vest. That's a great idea. So we have another question here. So what solutions for OA and severe arthritis in the feet? So say walking is not really the best option. There are patients out there who have, really severe arthritis in the feet. What would you say is a good solution for them?
I think first solutions for arthritis in the feet is there's a couple of potentials, like having a good supportive shoe. So if you have a foot that needs more support, having that support. If you have a foot that needs more flexibility, having that. So being fitted for proper footwear that makes you feel good and be more efficient is important. Sometimes an orthotic might be necessary. That doesn't mean you have to go out and spend $500 or more on a custom-made orthotic. Sometimes you can just get them over the counter or order them online. I know I've had patients get things from Superfeet and places. I had some really good options because, as we have arthritis, sometimes we'll have collapsed medial arch or those types of things. So having that additional support, because if you're to fall, it's going to activate different things up your chain through your hip and your back. So you might not even realize your feet are causing your back pain, and it really can be that simple. So making sure that you have good support for your feet is critical. And we even have shoes for the water that you can wear in different pools that will also be able to help give you the support, so that even though the water unloads you while walking, you can still have that good stability in your shoe.
Awesome. Thank you so much for that.
The other thing I think with as far as the whole walking and the arthritic situation, when we're looking at walking, it seems that we have a mentality that we have to, in order to get more fit, we have to always walk faster. And that may not be the situation. It may be that we're doing an interval walking. It may be that we can walk on other surfaces, certainly the water. And when we get to that, there are tons of things with the water. But also looking in terms of maybe I'm someone that can tolerate up and down small, I'm not certainly talking hills, but can I go up and down on uneven surfaces? It isn't necessarily just strictly, I've got to go faster, 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 because it's certainly going to have possibly a negative effect.
That makes perfect sense.
The other thing, if I can add around walking, is we know that those who've been diagnosed with different types of arthritis have higher instances of anxiety and depression. And walking outside, we know that being outside in general is a boost for the mood and can have positive effects on our mood and anxiety and depressive symptoms. So I would definitely suggest that as well, making sure that whenever possible, if you are going for those walks, to choose outside if that's an option for you.
Yes, and I completely agree with that, Jackie, because earlier I actually went outdoors because when the pandemic started, of course, we all were just confined. Some of us still are. And so literally I live in this space. I work in this space. My virtual classes are in this space. You don't see my area, but literally I'm always in here. But going outside always, it's just a good mental break. And that vitamin D, it makes all the difference in the world. Complete mood changer. So I completely agree with that. So going back to the weighted vest, Jackie, is it a potential problem for hip or knee injuries? Like if they're an OA patient, could it be a potential risk if they have hip and knee issues, the weighted vest?
Right. Yeah. And I bring up the weighted vest because of a lot of research out there has been done on hand weights, ankle weights, things like that. And there is research to suggest that using hand and ankle weights can be a good way to influence positive changes in the cardiovascular system. However, using those hand and ankle weights does place a different biomechanical impact on the body, as we know. So you do definitely want to be concerned about that. So taking the weight from our extremities, from the outside edges of our body, our ankles and our hands, and placing it closer to our core, closer to the trunk of our body where our spine is, and that the job of the spine is to maintain the posture of the body. So taking that weight away from our extremities and placing it closer in towards our trunk decreases that biomechanical impact, while still having some positive impact on our cardiovascular system if we're doing it while we're doing something like walking. But definitely the other folks here, I think, have some thoughts on this as well.
I agree completely with you. The weighted vest is a great way to go because you don't have to go super heavy, and you can go higher weights. So you can take pieces of the weighted vest out and start small. Experience, my best friend's husband had a weighted vest for Christmas and did everything with the weighted vest on, and he wound up hurting his back because he didn't build up to it and was doing extremes. So you just have to be mindful of that. And like Jacques said, getting your core to activate is really an important piece because that's your center of everything that you do. And
absolutely,
you had said one of the areas that was problematic for you was your wrists. So having to hold wrist weights wouldn't be a functional way for you to activate. About things like if you're holding weights in your hands, so if you hold it in your left hand and like you're walking, whether you have a purse, a bag, or a weight, you're actually causing the opposite glute to work harder. So trying to keep a good balance and keep it centered is probably the easiest thing to do, and it kind of frees you up to move as you please.
To move about, yeah. That makes sense. Awesome. All right, well, let's move on from walking to cardio machines. So let's talk about equipment. Are there machines that are more joint friendly over others? I would say yes, but I'll let you all elaborate.
I feel like we could take a poll, right? Yes.
Yes.
And the winner is. Yes, I definitely agree. There's definitely machines that are more user-friendly than others when someone has received a diagnosis of arthritis. And I would also, in big, bold letters, you have to make sure you're using the machine correctly. Just like we were saying earlier, if you're not set up on it properly, it doesn't matter if it's a low impact machine or not. The chances of, negative impact or increased risk of injury are higher, obviously. So definitely make sure that you're using machines according to manufacturer guidelines, that you're using and setting them up properly. That's where a certified professional can come in and make sure that you're fitted properly for whatever machine, that it's the right height for you, seat height, all of those things. But I would definitely suggest stationary bicycles, rowing machines, ellipticals, things that are a little bit lower impact.
Right. So just to get a little bit more specific with the types of machines, can we talk about which machines would be best for the type of joint issues? So say, for instance, the elliptical, what would you say with knee issue? Well, let's talk about knee issues. So what machines would be specific to knee issues?
So from working with patients that have a lot of knee OA, and especially I see a high population of patellofemoral arthritis, which is a really small joint that creates a really large problem. So things that I always tell my patients is think about, when you're thinking about cardio pieces of equipment, your bike is your least amount of impact, your elliptical is your middle tier impact, and then your treadmill, walking or running, is your highest impact exercise. So kind of going in that gradual progression. And I always look criteria they are meeting before I say you're okay to use it. So something that I have found in my practice that's always safe is if they can ascend appropriately a step of 6 or 8 inch height, they can usually do an elliptical well, because a common problem that people will do is that they'll become pullers and just use their hamstrings on the elliptical instead of pushers, because you got to use your quad just as much. So you can't be dominant on one side and not utilize both sides. Otherwise, you're just going to cause overuse.
Right.
Another machine that I do like, and there are, like we said before, it doesn't matter the machine, it's how you set yourself up on the machine. A leg press, because you can control the load. But if you are put in a position where your knees are coming above your hips, it's not the right spot, and you could cause more harm than good. And then I always love doing functional movements. But if you don't know how you're moving, it's easier to get on a machine and move with that machine to start getting some weight, and then work with somebody, a physical therapist, a personal trainer, a fitness expert, to make sure that they're looking at how you're moving, because how you move is going to affect how you do.
Absolutely. Does anyone else want to elaborate on that? I think that was great. All right. So what can we do to maximize our workout on these machines? So are there any tips on how to safely increase the incline, the resistance, speed, safety, and things of that nature? So how can we maximize our workouts? Oh, Marty, you're on mute. Can you unmute yourself?
Yes.
There we go.
I think initially we need to establish a baseline, and not, we don't want to call it a test, because that's off-putting, but to establish our baseline, and then to explain to folks how scientifically to increase, whether it's a bike, it's a walking program, it's an elliptical, and ask them to really stick to that and record it some way, in the phone, on paper, whatever, because I think that it does two things. It kind of keeps you honest, first of all, but the other thing is it allows you to look at that and evaluate yourself to say, you know what, I had a good workout today, but I'm really sore the next day. Maybe I need to look, did I go up, try and go up 30% when I should be going up 10%, say, in mileage if you're running or walking. And I think allowing people to self-evaluate is a great way to do that. The other thing is to actually really put that information front and center, because I think, I'm good. I was an athlete. I can do this. And it's being respectful of the condition, but also being respectful of the science. Those numbers, the 10% wasn't made up. There's a lot of research to back that up. So I think really allowing them to have their own program and they can set the parameters. I think one of the things that we do oftentimes is to say, okay, we'd like you to start out at 10 minutes or whatever. And we tell them, keep going, it's great, but we don't oftentimes give them an accurate way to progress. And I think that that's critical to any machine that you use and any program that you're undertaking as far as fitness. And that's where the professional comes in, just guiding them, giving them a few little parameters that they can live within and make it all good.
I agree, Marty. Yeah, I definitely, from an exercise programming standpoint, that 10% rule, like you said, we got to respect the science. It wasn't something that was just made up out of nowhere. Yeah. So, monitoring this week, maybe they were able to, if you are on an exercise plan and your goal is to increase the duration of your long walks, for example, really trying to stay true to what we call in the exercise world, progressive overload, where you are just one step at a time, 10% in this case at a time, slowly progressing, so that you don't find yourself in a position where, oh, I really enjoyed that and that was so great, but now I can't do anything for 4 days. You really want to just, again, as Marty was saying, internally monitor yourself, and then working with that care team to make sure that you have a plan that you can stick with.
Absolutely. Okay, so before we move on from the machines, so what about using machines safely with OA in the hands? So in regards to pushing and pulling on the elliptical, rowing machines, for people, like me, even with RA, with the arthritis in the hands, what would you say about safely using those types of machines?
I can talk as it relates to the elliptical is be doing a majority of the work with your arms. Your arm should be kind of gliding and it should be more focused on your lower extremity.
Yep.
Yeah.
Absolutely.
So whether you have your arms on the pieces that move or have them on the stable place, it's more of a lower body exercise. So do what's comfortable for you, and like the size of the grips may be part of the problem if they're too thick and you can't feel like you can't get a good grip because your hands are small. Try not to anything. And then as for rowing, if you're talking about an erg or if you're talking about a seated rowing machine, so if you're talking about a seated rowing machine, you're looking more to work your postural muscles, your scapular muscles. So you should be okay with that and start light. Sometimes you have a seated machine. Sometimes you can have a free motion machine, so you can alter the handle pieces that you have. Jackie, Marty, I don't know if you have other insight there. Probably you do.
Oh, Marty, you're on mute.
Yeah, sorry.
I think that's the most popular quote over the last year. You're on mute. You're on mute. Sorry.
I certainly concur with everything that you've said, Jessica. And I think, again, it's giving folks accurate information as to how to position. The elliptical is a prime example. And oftentimes I'll say to folks, okay, let's do arms and legs. Now let's take away the arms completely. Do you see how much harder your legs are working? Or maybe they're not. If they're not, you've done it right. If your legs are suddenly working so hard, you've done way too much with your arms. And just to show them that that's actually something they can control. And it's a difference between whether they're going to be in pain, whether they're going to affect it. And I think throughout this whole discussion on fitness, we need to not stress it, but at least give the information that, hey, you can actually damage the joint. And because, no one chose to have OA or RA. it's a disease process, and we want to be respectful of the process so that you can always continue to improve and work out. We're not trying to limit you. We're trying to expand what you can do based on the fact that, unfortunately or whatever, you have this disease process. We can work with it. And I think it can be more positive than, oh my gosh, I've read about OA, I'm going to have a knee replacement at 40. That doesn't have to be the case. And I think that's where the fitness professional, the healthcare professional, and the healthcare team, as we've talked about all through this discussion, comes into play to make it a positive versus a negative experience. And I try and equate it with patients to say, you would never put me on a bench press and ask me to start out by bench pressing my body weight. Why would you start a walking program at an hour? And if you've never walked. So it's kind of, if we can give them some similarities, sometimes it's a little more digestible, and it sounds like it's fair because the disease process isn't.
I agree. All right, so let's move on to water exercises. So this will be for our aquatic experts, Marty and Jessica. Can you give us some tips on how to get started on an aquatic exercise for arthritis? Tips for getting started.
I think the biggest thing is if you like the water, and if it's somewhere that's key. If you don't like the water, let's stop talking about it. But getting into a program that is, and the Arthritis Foundation has incredible programs for exercise, and they give a lot of different exercise modifications to help you to not only appreciate and enjoy the experience, but also become fit. But nonetheless, instead of saying, look at a book and just start on the exercise program yourself, I think my first tip would be to get into a class where you know that the instructor is knowledgeable, and that maybe speaking to that instructor ahead of time to say, I have problems with my knees. Can you give me some viable modifications that would help me? Because you can become very strong in the water. And we all look at things such as buoyancy as totally unloading us, but you're not ever totally unloaded. And if you're water running quickly, you can actually be bearing more than 100% of your body weight. So we have to understand the physics as well.
Absolutely. Jessica, do you have anything to add?
I just think some people think when you say water exercise that you have to be swimming, and you don't. And just like Marty said, with a lot of my patients, we see different levels of patients, of their capabilities and what they want to get back to doing. And you could do plyometric circuits in the water. It's just it within, and remember the buoyancy and the resistance of the water, and the, oh my gosh, that's the word I was looking for. But your cardiovascular system has to work harder in the water. So it's in making sure you remember that. And, when you're working out in the water, make sure you have water on the deck, because you're going to become thirsty and tired.
Absolutely.
And so add onto the water exercise point, Jessica, that you just made, that from a performance standpoint, if you've been watching athletes at all, in your career or in your fitness life, a lot of athletes are using water exercise as a part of cross training because they understand the benefits of it, and it's helpful to them, reducing that impact on their joints while still giving them that great cardiovascular workout. As you said, implementing some plyometric type exercises, sprints. You can do a whole bunch in the water that can really benefit you, regardless of where your pain is. Things can be modified. So definitely something to seek out if you have an interest in water. As Marty said, you got to like it, but definitely something to seek out because it's a great, great form of exercise.
I'd also add one last thing. Of the athletes that I've worked with that have conditions, and through the whole age spectrum, I don't work with children, but young adult to older adult, that is the older adult elite athlete. At first, water is like, oh, that's for old ladies. But actually, when we talk about water and actually give the research behind it, deep water cadence running was developed by Nike for their Olympic athlete hopefuls that were injured. And so the very elite athlete can use it as well. And the research is pretty compelling. And I think if we can also address that for some of our athletes, it's a little more, becomes a little more amenable versus saying, well, I think you should run 1 day a week, do your workout in the water, because we can give them a very specific workout based on what they know for their heart rate and all of that, for their land workout, to just be an ancillary. And also, we just never can forget what Jessica mentioned, and that's the water on the deck, because water, really being in the water and working out actually eliminates your thirst mechanism. It's a whole physiological component, and people don't realize that. And then they get out and they've got a headache, and we've set them up for that. So that's a great reminder to let them know.
Awesome. So do you have any tips about using floats that are designed for water exercising, like specific floats?
There's a ton of equipment out there, and if it's flotation device you need, or if it's a resistance piece, first of all, just like we've been talking with the elliptical and the rowing machines and all of that, it needs to fit you properly. It needs to probably be something that you've tested out. There are great intense tools, but some of them, if we're not using them correctly, certainly the injury capability is there. But there is a ton of equipment, and I would say, rather than become very specific and name names kind of thing, to actually have someone give you some instruction, and you may choose what your preference is. For me, I have a preference of equipment, and it's just my own personal preference. And there's nothing to say that the other pieces are wrong, and I certainly use them with my patients, but I just happen to like this. So develop a good workout. Also, to let them know that that's not a wrong thing. Flotation devices, if you move them fast enough, become resistance equipment. So we kind of have to give them a little bit of, there's a little learning curve doing water exercise, but it can be incredibly beneficial. We certainly see it with the professional athlete, the elite athlete, and those of us that are getting older every day.
Absolutely. Well, I must say that I'm inspired, because I do not know how to swim, but it's on my goal. It's a goal on my list. And I think that that's the perfect way, to learn how to swim and then get into some of these, aquatic exercises. It's like you say, it's great cross training. So I'm inspired now. So thank you for this information. So
if I can just...
No, go ahead, Jessica.
Sorry, if I could just add to Marty with like the tools that you use in the pool, is you can think very simply and very cheap, and you can do a lot. Like if you went to a dollar store and got a couple of noodles, you can cut them into smaller pieces. You can use them as a whole. They're like $1, and you can do so much with them. Even if you have like a Frisbee and you use it in the water to do different movements, it's more resistive. So you don't need a lot to get a lot out of your exercise in water.
Absolutely. Great. All right. So let's move into high intensity and low impact moves. So which are the safest moves for painful joints when we're talking high intensity and also low impact moves? What would you say are the safest for painful joints?
I think I'll let the PTs answer this one. But when I'm working with clients and they have pain, and we're talking about what's on a pain scale for them, what their pain scale is telling them, anything above a 3 on that pain scale of 0, I have no pain at all, and 10, I have the worst pain imaginable. Anything on that 3 or above, we need to modify or stop. And so any movement that, is below that, then still probably safe, but otherwise something needs to change there. So sorry, Jessica, go ahead.
No, that's a great point. And I, oftentimes patients will come in and be like, it's no pain, no gain. And I'm like, no pain means gain. So I can't have you working through pain, because it's like, if you have a headache and you're hitting your head against a brick wall, you're not going to get anywhere with your headache. So it's about looking at how they're moving, doing just like Jackie said, find those modifications, change them up, still work them, But a lot of times, if they're having pain with loading, I'll unload them and simply do some table exercises to isolate the muscles first before going back. And I never take anything out forever, but we might just be having a flare or a bad day, and we take it out for this session and we revisit it again, because it doesn't mean it was bad. It was just, might have been off.
That makes sense.
Yeah, I think that's a great point, Jessica, about monitoring on the day that there is pain or an increase in pain. If someone is complaining on that day, just could be a bad day. So it's important to come back to that exercise or that movement later and say, so was it just the day or was it the actual movement, to really have a full assessment of what's going on?
Yeah. And so I have a question. So as far as like, what would you say if your client, as far as distinguishing pain that is associated, of course, with their joints versus pain in, actually like really working those muscles? Like, what would you say is the best way to distinguish between the two? Because I know we need to, know our limits first of all, but, there's clearly a difference, between if we're doing an exercise wrong, incorrectly. And so I think you kind of feel what I'm trying to say. I'm trying to word the question, but distinguishing pain versus, really actually working the muscle effectively.
I find oftentimes our patients don't know the difference between soreness and pain.
Absolutely.
So ask them to take with one finger, point for the location of where you're feeling that pain or discomfort. And if they point to the joint, then I know we need to reassess and go back and look at what we're doing. If it's muscle belly, I said, fantastic, keep it going.
Keep it going, yeah.
Muscle working, but that's my motto.
Love it.
So important too to really give them the ability or capability to talk about the pain, because most of the time it's I'm a baby, I should be working out. And as Jessica said, a great piece of where does it hurt, and it also might be that we might be able to just tweak an exercise and it becomes pain free. The pain piece often too is it. Especially if someone had been an athlete and has developed any of the arthritic situations, they're much more reticent to admit that they have pain, because it's obvious that my pain is because I'm not fit enough or because I'm doing something wrong, versus your pain could be the disease process. And let's let you work at distinguishing that. And I try always to have an individual at the end of either a training session or physical therapy. How are you right now? Where are you at right now? And what can you point to what hurts? And that seems to be helpful as well.
That's a great point, Marty. And to Jessica's point about where does it hurt? What's going on? I find too that for clients in my world as a fitness professional, if they don't quite grasp the difference, also monitoring the duration of the pain or discomfort that they're feeling after the exercise bout is over is really important. Delayed onset muscle soreness, we know it as DOMS, or just like achiness, and somebody might describe it as a little bit of achiness or tenderness in the muscle belly. That can be a really good thing, but we don't want DOMS to continue for 5 days after a workout has occurred. And same thing with other joint pain. We would want to just monitor the length, the duration of how long that pain is lasting after the exercise is over.
Absolutely. Okay, so we have a question that just came in, going back to the aquatic exercises. So using a large hot tub for aquatic exercise, would you recommend that? No? Okay.
There is
Want to elaborate?
Too hot. You have tepid environments that you want to work in, and a cooler pool, because you're going to increase your heart rate and your temperature is going to go up. You're going to start to sweat. But usually you want to keep your pool that you're working out in under 92 degrees. So hot tubs typically run 98 and higher. And that is what I call a too hot environment for anything but relaxation.
Makes perfect sense. Thank you. Thank you. All right, so let's move into seated workouts. So seated workouts, who are these best for? Who would be your typical clients for a seated workout?
For me, I think it's someone, I'm sorry, did you want to go, Jackie? Oh, for me, the person that I put sitting always is the one that has poor balance. If they're actually trying to do a resistive exercise regimen, certainly if they have poor balance and I want to work on it, that's another story. But if we're talking about resistance, are they safe? Are they able to follow instruction? And perhaps a seated workout might be the person that is very deconditioned and is actually afraid to start working out, start exercising. We want it to constantly be a positive atmosphere and a positive experience versus, no, you can do this, stand up. And maybe I believe they can stand at that time and do some things. But if they're reticent to work out or afraid to try, seated is actually pretty safe. I don't have to worry about falling, and I can pretty much be much more in control.
Okay, and just to expand on that a little bit, what would you say are some of the best seated exercises as ways to maximize the intensity for a good cardio workout? Because I do believe that you can, work up a good sweat, if you're doing the right exercises in the seated position. But what would you recommend as some of the best exercises to maximize that intensity?
From a cardiovascular standpoint, since that's our focus here today, we talked about some of the other machines earlier, using a elliptical, using a stationary bicycle, things like that. I would also, I will fully disclose, I was a collegiate rower myself, so I'm a big fan of the rowing erg. But I also think, just as we said earlier, that using those properly and using them as fitted for you, for your size and your goals is important. But from a rowing standpoint, as I said, some of the highest VO2 maxes have been measured from rowers. And so that's a great cardiovascular workout when done properly.
Correctly.
Because rowing does involve almost all of our major joints as we're moving. So we do want to be sure that it is done correctly, and working with somebody that understands how the rowing motion is supposed to go and where the tension is supposed to be on the work is really important there.
Perfect. All right. So I've got one question for our joggers and runners. So when would you say it's time to stop running and move on to lower impact exercise? If they are, having issues, but, they just love jogging and running, when is it time to just kind of slow it down, scale it back, and do more low impact exercise? Anyone want to take that one?
For me, with joggers and runners, it's one of the hardest populations to treat because a lot of joggers, runners make the mistake of, when you ask them what do they do for exercise, they jog and run. They don't prepare for their sport. So sometimes I might say, well, if you have pain, we're going to shut you down for now. That doesn't mean you can't do cardiovascular work, but I'm going to ask you to do lower impact exercise where you can get your heart rate up and you can still work hard. And then we can reassess kind of what do we need to do? Like, what's not working well for you? Is it your glutes? Are they not working efficiently? Try to focus on building some strength and then re-looking at your mechanics of your run. So you might have faulty mechanics that have led you down this path, but we want to keep you moving. We don't want to stop you from moving, because if we stop you from moving, that's the worst thing we can do for anybody. It's just trying what fits that time period. So I usually say, if you're having pain doing blank, we're going to hold off on that. Let's find something else that's pain-free for now, and let's work towards it, reassess, and then continue from there.
Makes perfect sense.
Yeah, I think definitely understanding from the runner jogger perspective, a lot of times I think I'll use myself as an example. I want to do a half marathon, or I have these kind of bigger goals in mind. So understanding from the client or the patient, why do they want to run? Like, why is that important to them? Is a really helpful thing to understanding their values around running and what it means for them in their life, I think is really helpful, so that you can help them get back to where they want to be, but also work with them, and that relationship with running that they have, so that it's a positive one and it doesn't turn into a negative thing. Because we do, again, want them to keep doing the things that they love and enjoy and help them maintain their activity levels. But as Jessica said, there has to be some kind of a dialing back at different points so that we can then help them reach those goals.
Got it. All right, so let's talk about assistive devices. So this may be more geared towards you, Jessica, and if anyone else can jump in. So we get a lot of questions about assistive devices. So Jessica, can you explain what the different types of assistive devices are and how to use them correctly and safely for a workout?
Yeah, so a lot of times with assistive devices, it can be like a bracing. So you want to that whatever needs support has support while it doesn't limit you from having mobility. So you want to know what you need. So sometimes if you get swelling in the body, you might feel better about having like a compression sleeve on your knee, or it could be on your elbow, whatever it could be. Like you might get flare-ups, so make sure that you are maintaining that so you can help eliminate some of that swelling that can occur. Sometimes maybe a wrist splint to help give you some support so that you're not having floppy wrists, but you still need to be able to grip. So making sure it's stabilizing you, but not keeping you from having mobility is really a critical piece. And it has to fit you. This doesn't mean anything has to be custom made. You can get off the shelf ones. Usually better brands will have better options. You don't want to just go and get like, to the local drugstore and get that one that's $6.99 because it might be too short. It might not fit well. If you're having something for your knee, you got to measure how thick is your quad at certain areas so you get that proper fit. And then also there's the piece of taping. So some people prefer to tape, like if you think about athletes and gymnasts, they'll tape their ankles for some stability. You can do that, or even proprioceptive tape to help keep some muscle activation. So a big phenomenon in Summer Olympics back, you saw many of the volleyball players and swimmers with like kinesio tape and all this rock tape, and it was so cool. But it actually does have a purpose, and it works for some, and it doesn't. And some people might say, does it really do what it's supposed to do? And I've used it on people, and people have sworn by it. And others have been like, it makes no difference. So I think sometimes it's a component to what you feel. And just knowing that as you're applying it, that you're applying it in the appropriate way to have a maximal effect.
Very good. All right, so let's move on to workout plans. So as far as timing, how much does it really matter? Is breaking up the workouts just as effective as doing a longer stint? So for example, 3 10-minute workouts versus just a 30-minute workout. And again, I would say this probably depends upon the client, but what would you say, does timing really matter? The short stints versus the longer versions?
Certainly from a exercise programming perspective, we have to keep in mind what the client or the patient is ready to do, what their physical capabilities are on that day. They may have planned a 30-minute walk and get 10 minutes in and go, it's not happening today.
Yeah.
So I would keep in mind that any physical activity is better than no physical activity. So even short bouts is wonderful to their comfort level. But definitely back to the idea about progressive overload, we want to make sure that you have a plan, that you're working with a professional certified personal trainer who can help you in developing that plan so that you can progress safely and effectively, so that if 30 minutes is your goal, that you can reach that goal without increasing your risk for injury. So just a couple of things to keep in mind there.
Absolutely. So what about the time of day, morning versus evening? I guess that too would depend on, the client, and because I know for me personally, my joints are a little bit more stiffer in the mornings. And it takes me a while just to kind of, get warmed up. So it's not like I can roll out of bed and just go right into a workout. Like I need about a good hour and a half to, get myself warmed up and ready. So would you say time of day matters, or I guess it would just depend on the patient, right?
For me, I'm always like, it depends. Do it when it fits you best.
When it fits you best.
Going to do it. And also back to like what Jackie was saying is like, you don't want to give them something that's too much to start, because then they're going to shy away from it. As I'll tell people, I'll be like, let's start small. And like, you tell me, is it working for you? Does it fit your lifestyle? Because you want it to become a healthy part of their life. You don't want them to feel overburdened by having to exercise, because they'll very quickly, and it's harder to get somebody back once they've turned off.
I agree, 100%. So, so that brings me to my next question with warm up and cool down. So we all know that that's very important, just to eliminate, the risk for injury. So how much warm up would you say is required to protect the joints, to make sure that they're warmed up, ready to go?
I think this is another one of those, it depends.
Yeah, it really does.
Like everything, right? It depends.
Yeah.
But certainly, even if you have not received a diagnosis of any type of arthritis, a warm up and a cool down is something that you don't want to skip. There are physiological reasons and benefits for doing both. And so you want to ensure that you have planned for doing your warm up and cool down. But certainly if, like you mentioned, that if you are not a morning person, if your body isn't ready in the morning, if it doesn't feel like that's the best time of day for you to be working out, you modified it and moved it to the afternoon or evening. If your exercise plan for that time of day is shorter duration, higher intensity, you definitely want to have a longer warm up to make sure that you are prepared for that shorter duration, higher intensity activity, whatever it might be. So I would always say a minimum of around 10 minutes, depending on the person, but that can include things like general movement, walking, or jogging, along with dynamic movement patterns that are going to mimic what it is that you're about to do, to make sure that your body is ready for that. And also, we've seen research that supports foam rolling, over total body foam rolling is a great way to improve circulation and enhance the muscle tissue and warm it up for those activities that we're about ready to do.
Right. And so what about cooling down? What would you say about cooling down, as far as the, what's long enough?
Another, it depends. Right.
Yeah.
Go ahead, Marty. I feel like you've got the.
Well, I think, again, it really depends on the intensity of the activity that they were undertaking. It also depends on their physical status. You've got somebody very high, doing a very high intensity workout. They need to take some time actually to let not only the cardiovascular system equalize, but also just let those muscles come back to a real normal state, a normalized state. And I think what the bigger deal with both warm up and cool down is to give folks some very specific information to fit their individual wherever they are. I have a client right now whose warm up is, I've got to touch my toes. And it's like, well, that is a warm up, but you're doing a 45-minute, pretty high intensity workout. You want to make sure that the proprioceptors are turned on to be able to turn on those muscles and work appropriately. The risk of injury is higher. We also need you to just give your body a time to come back to equilibrium. And I would say, I tell clients, can you do that in 5 to 10 minutes, depending on your workout. I try and give them specific things to do. And a lot of them are functional movements versus, everyone seems to think to warm up, I have to stretch, to cool down, I have to stretch. But if we can get through some functional movements, we can get through that full range of motion and much more safely.
Right.
And I also think like the warm up and the cool down should not be more than your actual workout. So you shouldn't be exhausted from warming up and cooling down. You should make sure it's exactly what it is intended to do, warm up and cool down.
Right. Okay, I believe we're freezing here. Okay, it looks like a couple of people are frozen. So I'm not sure if you all can hear me, but I wanted to see if we can explain some of the benefits of foam rolling. Can you all hear me, Jessica?
Yes, Ashley, you're back. We can hear you.
Okay, yeah, you all were everyone was frozen except for me. I'm like, okay.
This is the world that we live in now, right? Where everybody gets that one frozen piece on their screen for just a second.
Right. Well, we're just about to warm up to actually wrap up. But so I wanted to go back to foam rolling and see if you could explain the benefits of that.
Mm-hmm. Right. So I'll let our other two ladies here tag on because I feel like they've got some great tips here as well. But as I mentioned, there has been a lot of research done on foam rolling and its benefits and uses, a lot on general population as well as athletic population. It has been shown to improve performance in different areas. The mechanism is that by rolling the muscle, in this case with a foam block or a ball, or there's a lot of different tools out there now that can be used to promote, again, circulation within the muscle, to promote muscular heat and build heat within the muscle so that it is prepared for movement, and again, a little bit mimicking what we would be doing in sort of a dynamic warm-up with a bit more intention and intensity in different muscle groups. So if you've got some different areas in the body that are a little bit more tender, a little bit more sore perhaps, sometimes that can be helpful for somebody as they're preparing to do a workout. But I'll let our other two ladies here weigh in as well.
For me, with rolling, I like to do that with a lot of my patients, just because it's also quick and easy to do, right? You get the tissue warmed up, you have one tool that you're using, and focusing on movement as you're doing it, not so much like that static stretch and hold time. So it's more like a soft tissue mobility, and it's self-generated. So you know how much pressure you're putting in, you know how much you can do, and there's different density foam roller. So if you're a new foam roller person, you're going to get something that might be softer, because if you get the highest density foam roller, you will never go back to try it.
You will never go back.
Right? And it doesn't mean you have to work your way up to the hardest one, the ones that have like the spikes and vibrate. No, you don't need all that. You need a very simple one to get into your routine, and your routine take between 5 and 7 minutes. So it's really time effective, and you can get a lot of targeted tissue.
Love it. Awesome. So I've got one last question. So we kind of touched on good pain and bad pain earlier. However, I wanted to see if we could answer and be more specific about how we can minimize the post-workout pain. And so we may have already answered this to a certain extent, but in case someone joined late, I wanted to see if we could touch on that again. So the difference between good pain and bad pain, and how to minimize the post-workout pain.
Well, I think we've actually touched on almost all of these things at different points around our discussion today. So we've talked about hydration, making sure to stay hydrated. That's a important piece of making sure that the body has enough fluid to do what it needs to do to heal itself, because DOMS, our post-workout delayed onset muscle soreness that we feel after a workout, a new workout, or a difficult workout, is an inflammatory response in the body. So we want to be able to help our body heal through that. And that can be a good thing. It's a good thing that that's happening. So we want to make sure that we're doing what we can to get stronger after our workout. So recognizing that it's DOMS, staying hydrated, doing your cool down, as we talked about, foam rolling could be a part of that. Also, massage or self-massage is a great way to promote that healing process as well. And just, again, monitoring the amount of time that DOMS is sticking around so that you can understand if what you did was a good thing or maybe needs to be reassessed or, modified in the future.
Absolutely. Thank you so much for breaking it down again. So I think that concludes the presentation tonight. I don't see any more questions here in the queue. So I just want to wrap things up and just thank each of you for your expertise and just lending your time and your talents tonight. And so I want to say a special thank you to ACE, the American Council on Exercise, and the APTA, the American Physical Therapy Association, for making this event possible. So Marty, Jackie, Jessica, thank you so much for your time tonight. I know that everyone learned so much, including myself. And so we've got some great takeaways tonight. So thank you again so much. And for our viewers, thank you for joining us. And we appreciate you joining us tonight. And so take care and have a good night.
Thank you, Ashley.
You're
Thank you.
welcome. Bye-bye. Thank you.
Thank you.